Imagine going through your entire life carrying a single piece of tissue that has to stay perfectly transparent for 80 years without a single blood vessel to repair it. That tissue exists in your body right now, sitting right behind the colored part of your eye. And for most people, sometime after the age of 60, it starts to fail. When it does, the world doesn't go dark. It just gets foggy, glary, and strangely dim, like looking through a window that someone smeared with a thin layer of wax. That fogging has a name almost everyone has heard: cataract. But very few people actually understand what is happening inside the eye when it forms. And even fewer know that scientists are now testing something that has never been tried on a large scale before: an eye drop meant to treat the cataract itself rather than remove it. For decades, there has only been one real answer to a cataract: surgery. A surgeon removes the cloudy natural lens and replaces it with a clear artificial one, and it works remarkably well. Millions of these operations happen every year, and for most patients the results are close to miraculous. But surgery is still surgery. It requires an operating room, a recovery period, and access to specialized care that isn't available everywhere in the world. So the idea of treating a cataract with something as simple as a drop has been a dream in ophthalmology for a very long time. And that dream keeps colliding with two very different realities: careful clinical science on one side, and confident social media claims on the other. Let's start with the biology, because once you understand what a cataract actually is, you'll immediately understand why so many of the home remedies circulating online cannot possibly work the way people claim. Behind your iris sits your natural lens, a small, flexible structure whose entire job is to bend light so it lands precisely on your retina. In youth, that lens is almost perfectly clear. The proteins inside it, called crystallins, are arranged in a tight, orderly pattern that allows light to pass straight through without scattering. The problem is that these proteins have to hold that exact arrangement for decades, and nothing in biology is built to last forever without maintenance. Over years, oxidative stress and chemical changes cause those proteins to misfold and clump together, the same basic process that shows up in several other age-related diseases throughout the body. As the clumps grow, light starts to scatter instead of focusing cleanly, and the lens gradually turns cloudy. That cloudiness is the cataract. Here's the detail that matters more than almost anything else in this entire topic. The cataract is not on the surface of the eye. It is deep inside the eye, inside the lens itself, sealed behind the cornea and the iris, with no blood supply and no direct opening to the outside world. That single fact is the reason wiping the eye, rinsing it, or applying oil to its surface cannot mechanically dissolve or wash away a cataract. There is simply no pathway for a substance sitting on the eyelid or tear film to physically reach and rearrange proteins buried inside a lens with no blood vessels. People experiencing a developing cataract usually notice blurry vision that glasses can't quite fix, glare and halos around headlights at night, colors that seem faded or yellowed, and a prescription that keeps changing every year or two. None of that is dangerous on its own, but it can seriously affect quality of life, independence, and safety, especially when it comes to night driving. Now here is where the science becomes genuinely interesting. Earlier this year, a pharmaceutical partnership between Lexitas Pharma Services and Okasun enrolled the first patient in a new pilot study of an investigational eye drop known as ZOC2, 017217, tested at an ophthalmology practice in California. This is a multi-center, randomized, double-masked, placebo-controlled study, which is exactly the kind of rigorous design that separates real medical evidence from anecdote. The drop is derived from a molecule called lanosterol, and its intended purpose is to interfere with the very process we just described, the oxidative stress and protein clumping that drives cataract formation, with the hope of slowing that process down, or in an optimistic scenario, partially reversing it. Before anyone gets too excited, it's worth being precise about what has actually happened so far. Enrolling a first patient means an experiment has begun, not that it has succeeded. The company has also shared exploratory data from an earlier study conducted in China, reporting that somewhere between 50% and just over 86% of participants reached a level of vision equivalent to 20/40 or better after 12 to 24 weeks of treatment. On the surface, that sounds compelling, but there's a critical piece of information missing from those numbers: the starting point. If a participant already had vision close to that level before treatment even began, reaching that same level afterward would still count as a technical success in that kind of statistic, even though nothing meaningful changed. Without a clear baseline, and without knowing whether the treatment measurably slowed or reversed cataract progression rather than simply reflecting natural variation, it is genuinely difficult to interpret those early figures. They are an interesting signal that justifies running a properly controlled trial. They are not proof that an effective cataract medication already exists. To understand why anyone believed a drop could work at all, you have to go back to a landmark study published in the scientific journal Nature roughly a decade ago. Researchers studying families with an inherited form of childhood cataract discovered that affected family members carried mutations in an enzyme responsible for producing lanosterol. That led to an elegant hypothesis. If a lack of lanosterol was linked to cataracts, could adding it back help prevent or reduce the protein clumping that causes them? In laboratory experiments, lanosterol did appear to reduce the aggregation of crystalline proteins, and the same research team reported improvements in cloudy lenses taken from rabbits, along with visible improvement in dogs that had naturally occurring cataracts. That paper generated enormous excitement across ophthalmology, because if lens proteins could be pharmacologically reorganized, patients might one day avoid surgery altogether. But this is exactly where careful science and viral internet claims part ways. One exciting study is the beginning of a scientific question, never the end of one. When other research teams tried to reproduce those results using actual human cataract tissue removed during real surgeries, the picture became far more complicated. In one such study, researchers exposed lens tissue taken from 40 human cataracts to lanosterol and found no meaningful reduction in cloudiness. In a separately documented case, a patient with an early unilateral cataract used lanosterol eye drops for 2 months under careful clinical observation, and the treatment produced no measurable improvement in vision or lens clarity. At the same time, it isn't accurate to say the idea failed completely everywhere. Later laboratory work using a subconjunctival delivery method in monkeys with naturally occurring cataracts did show a short-term reduction in cataract severity. And a related compound called VP1001 has produced encouraging improvements in lens clarity in mouse studies. So the honest summary sits somewhere in the middle. The underlying biology is plausible, some experiments support it, other well-designed studies have failed to reproduce the dramatic reversal effect that made headlines in the first place. And definitive evidence in real human patients has, until now, simply been missing. There is also a practical obstacle that rarely gets discussed, and it may end up mattering more than the chemistry itself. Formulating a molecule into a drop is the easy part. Getting a meaningful concentration of that molecule to travel from the surface of the eye, across the cornea, through the front chamber, and into the precise region of a lens with no blood supply is an enormous pharmacological challenge. A dense cataract that has accumulated decades of protein damage may behave nothing like a cataract in its earliest stages, which means that even if a version of this treatment eventually proves effective, timing could turn out to be everything. Most researchers in this field now suspect that the first successful cataract medication, whenever it arrives, is far more likely to slow early changes or delay progression in specific types of cataract than to transform a dense, mature, whitened lens back into a clear one overnight. Now let's address the claim that has been spreading rapidly across social media that castor oil placed directly in the eyes can dissolve or reverse cataracts. This claim has generated an enormous amount of enthusiasm online, complete with personal testimonials describing weeks-long transformations. Multiple eye care organizations and reviews of the available evidence have looked into this claim directly, and the conclusion is consistent. There is currently no peer-reviewed clinical evidence showing that castor oil dissolves, reverses, or meaningfully improves a cataract. Remember the anatomy we covered earlier? The cataract sits deep inside the lens with no blood vessels and no opening to the surface. Oil applied to the eyelids or the tear film interacts with the surface of the eye and cannot physically reach or restructure proteins buried inside the lens. To be fair to people who genuinely feel their vision has improved after trying it, castor oil does have some legitimate, well-documented uses in eye care. Properly prepared, sterile castor oil formulations have been studied for dry eye and for eyelid conditions like blepharitis, where inflammation along the eyelid margin can make vision feel blurry or uncomfortable. If someone soothes chronic dryness and irritation, their vision can genuinely feel clearer and more comfortable, simply because a healthier tear film scatters less light. That is a real and useful effect. It is just an entirely different mechanism from clearing a cataract, and conflating the two online has caused a lot of confusion. One important safety note deserves emphasis here. Anything placed directly into the eye needs to be sterile and specifically formulated for ocular use. Cosmetic or household castor oil is not manufactured to that standard, and contaminated eye products have been linked to serious infections. Comfort from a healthier tear film is not the same thing as treating a cataract, and household oil is not automatically safe simply because it is natural. Beyond the lanosterol-based trial, there are a handful of other approaches worth knowing about, because this isn't the only serious attempt happening in this space. A small randomized study tested an eye drop containing a very low concentration of EDTA in just 41 eyes with early cataracts. After 4 months, the treated eyes showed better contrast sensitivity than the placebo group, along with some measurable changes in lens density. That is an intriguing early signal, but the study was small, there was a notable placebo response, and it did not demonstrate that a drop can reliably reverse a visually significant cataract or replace surgery. Separately, the compound VP1001 mentioned earlier is designed to stabilize lens proteins directly, rather than simply acting as an antioxidant. And while mouse studies have shown clearer lenses and improved optical quality, it has not yet been tested in human cataract trials. Researchers are also exploring next-generation antioxidants, anti-clumping compounds, and treatments targeting the specific biological pathway behind cataracts linked to diabetes. One particularly forward-looking laboratory study even delivered genetic material into the eye to prompt the lens to produce its own lanosterol internally. And in early rodent testing, that approach improved existing cataracts. It is fascinating science, but it remains extremely early and far from anything close to clinical use in people. While all of this research plays out, there are things that are already proven to lower your personal risk of developing cataracts. And unlike the drops, these don't require waiting years for a clinical trial to finish. Not smoking is one of the most consistently supported protective steps, since tobacco use is strongly and repeatedly linked to earlier and more severe cataract formation. If you have diabetes, working closely with your medical team to keep blood sugar well controlled meaningfully reduces cataract risk, since elevated blood sugar accelerates the same protein damage described earlier. Wearing quality sunglasses that block ultraviolet light protects the lens from a major source of oxidative stress over a lifetime of sun exposure. Long-term steroid use, whether inhaled, oral, or topical, is associated with an increased risk of cataracts. But that does not mean anyone should stop a medically necessary steroid without talking it through with their doctor first, since the underlying condition being treated is often far more dangerous than the cataract risk. And finally, regular eye exams matter more than people realize, because blurry vision isn't always a cataract. Conditions like glaucoma, macular degeneration, and diabetic eye disease can produce overlapping symptoms, and several of them are only treatable if they're caught early. It's also worth putting the scale of this problem in perspective, because cataracts aren't a rare curiosity. They are one of the most common conditions affecting older adults anywhere in the world. Cataract-related vision loss is one of the leading causes of blindness globally, and in many countries, surgery simply isn't accessible or affordable for large parts of the population. That's part of why a genuinely effective drop would matter so much beyond convenience. It could open up treatment to people who will likely never have access to an operating room, which is a very different kind of impact than simply saving a wealthier patient from a single procedure. That context doesn't change how early this research still is, but it does explain why serious scientists keep chasing this idea decade after decade, despite repeated disappointments. So where does this leave someone who has been told they have a cataract right now? The honest answer is that surgery remains the only proven, established treatment when a cataract is genuinely affecting someone's vision, independence, or safety. And a single early-stage announcement about a new eye drop is not a reason to delay or cancel a scheduled procedure. But it is absolutely worth paying attention to this research, because it represents exactly the kind of properly controlled, methodical science that this field has needed for years. For a drop like this to eventually change the standard of care, it will need to clear several specific hurdles. Proof that the molecule genuinely reaches the lens in a meaningful concentration. Objective imaging evidence that cataracts measurably change, real functional improvement that patients actually notice in daily life, and a clean, well-documented safety profile across a much larger group of patients over a longer period of time. If that evidence eventually holds up in large, well-controlled trials, it could represent one of the more meaningful shifts in how cataracts are treated in a very long time. Until then, the most reliable strategy available to anyone concerned about their eyes is the boring but genuinely effective one. Protect your eyes from ultraviolet light, manage chronic conditions like diabetes carefully, avoid smoking, get regular eye exams, and trust surgery as the proven option when a cataract has already crossed the line into affecting your daily life. Everything else circulating online right now, however confident it sounds, is still waiting for the evidence to catch up.